when we know someone with bad breath, we don't tell them, do we? I mean, if someone's fly's undone, you tap them on the shoulder and say, your fly's undone. But you don't say to someone, your breath stinks, do you?
Well, because there is a big social stigma attached to it. Whenever we bring up these campaigns to try and get the public aware of things, we find people, like we ask patients, will they go on TV for us? No one wants to put their face to this sort of thing. Big, big social stigma.
Is that right? Do people with bad breath not know they've got it? I mean, can you smell your own breath? You see people putting their hand up to their face, don't you, doing this. Does that work?
No, that doesn't work.
Why can't people smell their own bad breath?
Well, there's three main gases to bad breath. They can smell one gas, and that's basically the gas coming off the back of the throat. And that's because bad breath are sulfur compounds, and those sulfur compounds coming from the throat are pulled up into the nose, so they're able to smell that. But the offensive bad breath, which is ones coming from the teeth, the gums, and the tongue, they usually can't smell that because it's coming out through their mouth. Right.
So that's why.
Well, apart from that, there's a thing called acclimatization, which dates back to Stone Age times, where we shut out senses that are around us so we were better hunters.
So most people can't smell their own bad breath if they've got it?
No, they would only smell a specific sort, and that would be if they were basically sinusy, nasally type of bad breath.
So holding up your hand to your mouth like that and do it, that makes no difference whatsoever?
No, but most people that have bad breath are aware of it mainly because they would have a taste. You can taste the sulfur compounds, or they would have a coating on their tongue, so they can see other indicators.
Oh, okay. So there are other ways.
There are other ways, yes.
What are the signs then?
All right, well, basically, stick your tongue out, have a look if it's got a coating on it. If the coating is more than 12 hours old, in other words, you didn't scrape it off that morning, then that's going to turn into a smell.
Should we scrape our tongue every morning? Because a lot of the toothbrushes now come with tongue scrapers, don't they?
Yeah, but they're not good enough. They're going to just move all the particles around. You need to use a non-foaming paste or gel with a toothbrush to loosen up all of the particles on the tongue surface, and then you need a spoon or a tongue cleaner to actually scrape the debris off. A toothbrush just doesn't. It's not efficient enough.
All right. So looking for the coating on the tongue is one way of
That's
detecting
number one.
it.
Number two would be taste in the mouth, because sulfur compounds basically cause or other the bad breath smells, and they actually taste. So what happens is people that have a lot of sulfur will taste it. When their saliva dries up from stress, a lot of talking, things like that, that evaporates into the end, and they push that out. So taste is another factor in bad breath.
What causes it, though, really? I mean, are there obviously a lot of causes for bad breath?
A lot of causes, but it's a very simple equation. It's bacteria breaking down proteins, and it's the waste products of that protein breakdown. Most of the proteins are already in the mouth, in coatings that are on the tongue, the teeth, and back of the throat. Some of the proteins come from food sources that we put in our mouth. So if you have a high food diet, things like dairy, milk, cheese, yogurt, that sort of stuff, or eggs, if you're eating a lot of those, you're putting proteins directly into your mouth, and that's then being broken down by the bacteria.
Okay, so high protein diet can contribute to it?
Yes.
Oh. Is good oral hygiene important? I mean, flossing, gargling with mouthwash, that sort of thing?
Definitely. Basically, one of the smells of bad breath is a fecal smell. It's a decaying flesh type of smell, and that comes from people that don't have good oral hygiene, don't floss their teeth every day.
Certain illnesses, can they cause it?
They can. There's basically things like end-stage liver failure can cause it, but in general, most bad breath smells will come from the throat up, from the shoulder line up to the mouth.
And then there's food, of course. I mean, garlic breath is probably the most infamous.
That's right. Well, that's sulfur compounds. So when you've got your foods that already smell, so look at your fishes, your garlics, onions, cabbages, Brussels sprouts, all those foods that actually smell when you cook them, they've already got sulfur in them, and you're putting that sulfur into your mouth and into the mix of of mouth sulfur already. What
about foods that can help prevent or maybe even hide bad breath?
None of them really hide it. They can help prevent it. The celeries, carrots, the high fibre type of foods, or things that are going to stimulate saliva, will basically help to prevent bad breath. But masking agents like the chlorophylls and that don't seem to be that effective, or maybe in mild cases, but not in the chronic cases.
Is it an old wives' tale? Somebody told me once that eating parsley can take away the smell of garlic.
Yeah, I haven't seen it work that way.
All right. Why does our breath smell so bad in the morning when we wake up? Morning breath.
Morning breath comes from going to sleep with bacteria on your tongue. So what happens is when you sleep, saliva flow shuts down or is very low because you're not eating. Bacteria will start to multiply then in that environment. So you may go to sleep with one bug, you'll wake up with 4. And those bugs are then digesting the proteins, making the sulfur compound, so you get morning breath and morning taste. You avoid that by doing a very strenuous cleaning regime just before you go to sleep, not after.
That's right. Okay, so cleaning the tongue, etc., before you go to bed at night will help prevent morning breath.
That's right. Reduce the bacterial load in the mouth.
Well, there you go. I guess there are all sorts of... You think about love life. It's one of the things we mentioned in the introduction. But I suppose it can affect things like your career prospects as well.
Not only that. I mean, we will get emails every week from people saying that they're going to kill themselves.
Oh, you're kidding?
No, this is, I mean, if you're living with this 24/7 and it comes down to how this is going to directly affect your personality. So if you're living with it 24/7, some people just finally the last straw on the camel's back. You get people that will email us telling us that their careers just aren't going anywhere, people that are losing relationships, divorce. It is a really big problem out there.
All right, nice to talk to you. Thanks, Doctor.
That's okay.
Good on you. That's, amazing. Did you learn something there? I did. That's Dr. Jeffrey Speiser, bad breath expert and founder of the Australian Breath Clinic.